Nancy. I'm the RN that's going to be doing your assessment today. Can you please tell me your name and date of birth?
Jeff, June 29th, 1967.
Okay, today I'm going to be performing a mental and neurological assessment. This is going to tell me about different areas of the brain, maybe your parietal lobe, your cerebellum, the internal pyramidal part of your brain. First I'm going to start with the mental status, but before that, do you have any history of mental illness, any kind of neurological deficits, history of stroke, any kind of Bell's palsy, nothing like that?
Nope.
Any family history of
No.
that? Okay. It appears to me that you're clean and well-groomed. These things could hint at some type of mental status deficit. You're dressed appropriately for the situation. Your speech is clear. Your attention span is good. First, I'm going to start off with coordination of fine motor skills. This tells me about your cerebellum function. I'm going to have you tap on your knees for me, and then after that I'm going to have you go back and forth and back and forth. Okay. No stiff or slow movements. They appear to be rhythmic. Now I'm going to have you touch your thumb to your first finger. Again, I do not notice any stiffness. It seems to be rhythmic. Now I'm going to test the accuracy of your movements. I'm going to have you, with your index finger, touch your nose and then touch my finger. And do that a couple of times, please. Okay, that's accurate. Next, I'm going to have you take your right heel and run it up and down your left shin for me. Okay, and now the other side. Again, I'm testing the cerebellum, and this is the area of the brain that's responsible for movement. It does have other functions. Okay, next I am going to be testing your balance. I'm going to have you stand up for me, and I'm going to give you a little push just so you have a warning. I'm testing to make sure that you're steady on your feet. Now I'm going to do what's called the Romberg test. I'm going to have you stand with your arms out to your side and your eyes closed. I'm looking for any swaying back and forth, forward and backwards. You do not have any of that. Next, I'm going to check your gait or your walk. I'm going to have you walk up to that doorway and then turn around and walk back to me, please. I'm not noticing any loss. Okay, you can turn around. No loss of balance. You're walking with your heel to toe. Again, smooth, rhythmic. A positive sign would indicate some ataxia in the cerebellum or sensory loss. Okay, I'm going to check your primary sensory functions. I'm going to touch different areas, and if you can tell me where I'm touching. Close your eyes for me.
Arm, leg, elbow,
Okay. I'm going to do it. You may feel a little sharp.
elbow, wrist, ankle, other ankle,
Okay. Now, I need you to tell me if you feel anything cold or hot.
cold, 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 cold,
Okay.
hot, 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 hot,
Now, continue with your eyes closed. If you can tell me if your finger is up or down.
up, down, up, down, 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 up,
Okay. You can take off your shoe for me. I'm looking for peripheral neuropathy or loss of feeling in your toes. Can you tell me what position?
like scissors.
Okay.
Big toe up,
All right.
big toe down,
Middle of this toe.
down,
Okay. And other foot, loss of feeling here could indicate diabetes.
Up, down,
If it was one-sided.
right, down,
Okay, I'm gonna wash my hands, I'll be right back. Again, any kind of sensory loss could indicate diabetes, one-sided could indicate stroke. Now I'm gonna check cognitive or brain function, sensory function. This would indicate perhaps a lesion in the parietal lobe or the back lobes of your brain. Close your eyes for me. I'm going to have you tell me what that object is that I place in your hand. This is called stereognosis.
Heat.
Okay. Next I'm going to do what's called a 2-point discrimination. You can look. I'm going to poke and you're going to tell me if I'm touching you with 1 point or 2 points. Different areas of the body will have different lengths that you can distinguish whether it's 1 point or 2 points. Again, this is checking for parietal lesions. So, do you feel 1 point or 2?
1, 2, 2,
Okay, I'm going to do the same thing over here and tell me.
1, 1, 2,
Okay. Now, if you can tell me, this is called graphesthesia. Tell me what letter or number I am writing on your hand.
P,
Okay.
8,
All right. Next, I'm going to do what's called extinction determination. I'm going to touch somewhere, or extinction phenomenon. I'm going to touch somewhere, and then you're going to tell me where I'm touching. Go ahead and close your eyes for me.
elbow, shoulder, ankle, calf,
Okay, again, this is checking parietal lobe, and I do not see any sign of a lesion. Okay, now I'm going to check your reflexes. This checks the spinal segment. First, I'm going to check on your feet. You can put your foot up for me. I'm doing what's called the plantar. And your feet open, that's called plantar flexion, and that's how it's supposed to be. I'm going to do on this side as well. Okay. Now I'm going to check your deep tendon flexes. First, I'm going to check your bicep. Okay. Your brachial radius. Okay. Your tricep. Your patella. If you can scoot back in the chair for me a little bit. Okay. Check this side as well. Okay. Now I'm going to check for ankle conus. And that's negative. A positive would be your feet shaking back and forth or this way. Finally, I'm going to check your cranial nerves. First, I'm going to check your olfactory cranial nerve number 1. You could close your eyes for me. I'm going to ask you to smell something for me and tell me what it is that you smell.
flower,
Very good. Next, I'm going to check cranial nerve number 2. This is your optic nerve. It's your peripheral and central vision. If you can read this for me.
reading fun in the sun,
Thank you. I'm going to have you look at my nose. I'm going to wiggle my fingers. You can tell me when you see them wiggle.
now,
Okay. Next, I'm going to check cranial nerve number 3, your oculomotor, cranial nerve number 4, your trochlear, and cranial nerve number 6, your abducens. These have to do with your accommodation and also the movements of your eyes and your eye muscles. Follow my fingers. All right. I'm going to check your pupil size. making sure that your pupils dilate and accommodate correctly. Next, I'm going to check cranial nerve number 5, or your trochlear nerve, yes. No, that's your trigeminal nerve, and that goes around your face.